So it's the morning after the day before, so less than 24 hours after having hip replacement. Feeling good. Had a good night. Got about 7 hours sleep continuous. Just not tired now, which is very unusual for me in the morning. Not a morning person. It got uncomfortable before 10 o'clock last night. Low level discomfort, like 2 out of 10, that kind of discomfort. Bought a couple of paracetamol, we're fine, that got me through the night. So far this morning also feels fine. I've been up tipping around, bathroom, brushing teeth, stuff like that, so I'm just about to get some breakfast. And so far pretty independent, no real issues. I'm going to park myself up here on the sofa with the footstool for the day. I don't see any reason why somebody couldn't sit on an exercise bike and turn the legs very slowly after, certainly after an anterior approach hip replacement. Posterior approach hip replacement, obviously longer, just because of where the wound is, but anterior approach, I suspect, I'm not sure I'll be able to get a revolution, but it's worth a try. The difficulty is going to be getting on and off. Now, what I'll probably do is swing the leg back. Let me bring the pedal out and see. So there's two options. So option one is this, foot on the pedal and around. That was a dabble. Okay, so bring the pedal up to me. So let's bring the pedal around to my left leg. Okay. Just do so. I'm going to sit up nice and tall and get that revolution now. I'm just going backwards at the moment, just to see. Just positions a bit weird, and I want to support the left leg a little bit when it's down at the bottom end and the top end. So the top end's getting easier, bottom end's getting easier. Okay. Okay. Just do so. I'm going to sit up nice and tall and get that revolution now. Now there might be a bit too much resistance. Nope. Perfect. Perfect. So let's try it out for a couple of minutes. I don't have my watch on me or anything, so I don't know what the what the power is. I'd say it's fairly low. Yeah, that's. You can feel the tightness, certainly, you know, up around the front of the hip. I feel like I'm going to be saying that a lot about the tightness at the front of the hip over the next 2 or 3 days, because that's really all there is. There's no pain at all. Oh, this is interesting. Let me grab this. Okay. So, I'll use my other hand. Okay. So, can you see that? Look at where the knee is in the revolution already. It's going straight. Straight, look. Look, I can keep my knees close to the bar. 24 hours after having a hip replacement. So that is actually starting to free out. So it's similar to it's really similar to how the hip arthroscopy felt. I know it was a long time ago. It was like 11 years ago, but just even in comparison to what we see with the other patients who've had deal with patients who've had hip arthroscopies 1-2 days a week. It would be between like 4 and 8 of them a week, and we get them all on the bike the next morning. And so we always kind of say, look, for the first, they'll be tight because their leg will be full of water for the first 2 to 3 minutes on the bike, and then it starts to free out. Now the thing is to always, regardless of how much anybody's doing, how much you do the next time should be based on how you felt the last time, after the last time. If you do an activity such as this, like, so if I do this now and then in the next hour or 2 hours I'm sore, I'm properly sore, it's too early. Like, simple as that. It's just far too early. Whereas if I feel freer, which currently I do, and if it's a kind of maybe a mild discomfort, yeah, I don't see any reason why somebody couldn't do it, because it's not going to the extreme of the movement in the joint, so there's no reason that the cup would start to rock in this, and there's no resistance, so the muscles really aren't under any pressure at all. Yeah, so it's perfect. So I'm actually going to cut it to that. So I don't know what that is, probably three minutes maybe, something like that. Yeah, and that'll do. Okay, so we're getting off, leaning all my weight through the right pedal, and then sit back, bring the leg back around the back, and then hop off. Absolutely perfect. So I'm just going to measure the circumference of the legs just to see if there is any additional swelling. There was about 20 centimeters from my kneecaps up before the operation. There was about 4 centimeters of a difference in the circumference. So I would expect there's probably about 3 now, just with the swelling, but we'll see. So 20 centimeters is there. Flip that around. And that is 48 centimeters. 20 centimeters up from left kneecap. Top of the kneecap. Edge. Make sure the legs are the same thing. So centimeters, circumference around. And there is 40, did I say 85? 45 centimeters. So yeah, exactly as I thought. So 1 centimeter of a difference just with swelling so far, which is very little. There is definitely more swollen. You can't see it, but it's there anyway. So the dressing is there. That's a bit puffy, and there I can feel the tenderness, same as it was yesterday evening, from there to there. So all sensation is back. So it is that there's tiny bit tender. That's probably going to bruise. That is bruising. It's just not at the surface. So all of that is perfect. Perfect. There. Wouldn't even barely call it tenderness, to be honest. Nothing in this area. Out here, It's grand. Um, I actually tried sleeping on my left side briefly yesterday evening. It was fine. It wasn't sore. Just slightly uncomfortable after a few minutes. Um,